Today we shall be talking about breastfeeding, even for mothers infected with HIV. And to join me in this conversation today is Professor Ruth Nduati, who is a pediatrician at Kenyatta National Hospital. I am your host, Gabriel Mosa. So, Prof, tell us, what are the current guidelines for mothers who have HIV for breastfeeding? There is this myth that goes around that says mothers who have HIV cannot breastfeed.
HIV has been with us for a long time, and HIV is a serious problem. It continues to be a serious health problem in Kenya and the region. For an HIV-infected mother who is not on treatment, so she's not taking antiretroviral drugs, she's not virally suppressed, she can't transmit HIV to her baby. But not every mother who does that. In the old days, before antiretroviral drugs were available, what we knew is that 3 to 4 out of 10 HIV-infected women would transmit HIV to their children, and the transmission rate takes place either during pregnancy, at the time of delivery, or during breastfeeding. But we've made a lot of progress since those days. From around about 2010 and more so 2015, any woman who comes to an antenatal clinic will have HIV testing offered, and HIV-infected moms will be put on treatment. So we policy of test and treat. Even more important has been the encouraging people to test and treat and plan pregnancy. So if you're HIV infected, then you go on treatment, achieve viral suppression before you conceive. We encourage couples to test so that if your partner is infected, he should also go on treatment, and you yourself would take pre-exposure prophylaxis before you go, you conceive, so that way your baby will have very low chance of being HIV infected, whether it's during pregnancy, whether it's time of delivery, or during breastfeeding. When you treat a mother, you prevent transmission. In fact, the transmission rates are less than 1%. So the previous understanding that there's breast milk transmission and that for the HIV-infected mom, that it would have been, if she was able to afford formula milk, and if she was able to afford, she was in a clean environment, good water, that formula would have helped her baby, was no longer true. In fact, the breast milk provides food, and it provides protection against infection. So we even talk about HIV-free survival. Now, when mom is on treatment and baby is getting antiretroviral drugs to prevent transmission, there's no transmission of HIV or minimal transmission of HIV to the infant. And in that scenario, if you're not breastfeeding, you actually jeopardize the health of your baby. The not breastfeeding is a risk. Babies who are not breastfed are more likely to get things like pneumonia, to have more diarrhea, and those conditions are risky in terms of even death of that child. The breastfeeding, and breastfeeding not just for the first 6 months, we talk about exclusive breastfeeding, but also breastfeeding all the way to the second year of life. In fact, the guideline today is to breastfeed until 24 months, actually protects that child. So the key thing for an HIV-infected mother is, or for any pregnant woman in this region where HIV is prevalent, know your status. If you're HIV infected, make sure you get treated, adhere to the treatment as prescribed so that you have achieved viral suppression. And when you're doing that, you protect your child. You also protect your partner, because many times people have a discordant relationship.
That's true.
In the bigger picture of things, of course, avoiding HIV infection. So if you don't have HIV infection, then you don't need to worry about HIV transmission to your infant. Now that's easier said than done. If you're just on your own, you're not in a relationship, you know what you're doing yourself. Once you have a partner, then the importance of good relationships, faithfulness, but also going and testing together, knowing what your status is, both of you. And if any one of you is infected, going on treatment, and for the partner having prophylaxis.
Okay.
Then there are the issues of the technique of breastfeeding, you know. Good attachment of the baby on the breast,
latching,
good latching, prevents conditions like cracked nipples. So you remember, if you have cracked nipples, you have this bleeding, this, or if you have cracked nipples, you don't want to breastfeed as often. That kind of scenario can increase the risk to the baby. Yes, so good breastfeeding technique, very important in protecting the infant from HIV infection.
All right. Yeah. You said less than 1% of mothers will actually transmit the virus to their babies. So which brings me to my next question. Are there any risks for them during breastfeeding, like you're saying, like for example, the latching, as compared to mothers who don't have, or is it just the same?
It's just the same. I think the challenge, it's just the same. And this speaks to the importance of having good pregnancy care, good discussions around infant feeding before the baby is born, but also at the time when the mother has just delivered, supporting her for her baby to latch on well, and helping to build skills so that she is able to breastfeed efficiently.
True.
Yeah.
You had previously mentioned about mothers taking ARVs during their pregnancy and even during breastfeeding. Do these antiretroviral drugs affect the baby in any way, or is it completely safe?
The antiretroviral drugs we use are safe. There are three drugs which have been tested extensively in terms of preventing mother-child transmission as prophylaxis to the infant. This is the Debunking, 3TC, and Antiretroviral. Now that is the medicine that the baby might take. There's the medicine that the mother will take for her own treatment. Most of those drugs are not passed through, very little comes through breast milk. So we're not worried about harm to the baby. And the drugs that we give the baby for prophylaxis, they are well tested and been used for a long time, and they do not harm the child. Having said that, our program uses Debunking and Antiretroviral. Debunking, we use it for a limited period of time, because if used over a very long time, it starts actually causing anemia in the baby. But for the period of time we give the baby the drug, which is 12 weeks, baby is okay. The Antiretroviral, which we give until baby is completely weaned, has stood the test of time. It's been a great drug. It prevents transmission, and it's probably at least has been shown to be the most effective.
All right.
Yeah, but so that combination of mom is taking her medications consistently, so she's virally suppressed. The baby is on prophylaxis, and when we do that, risk of infection is less than 1%.
So a mother should be consistent. What if, for example, they're not consistent for a while? Then will transmission happen?
Yes.
Okay.
If you're not consistent, and in fact, when you look at the data, because we have not yet achieved the goals of eliminating mother-child transmission of HIV. When we do the analysis of those babies who have been infected, the categories are: one, mother got is newly infected either during pregnancy or during breastfeeding. The other is mothers who know their status, have been on treatment previously, but have stopped taking their drugs. And then the third category is mothers who are taking their medicine and they are not taking it consistently, so that they are not fully virally suppressed. Yes. So which brings us in the importance of counseling and support. You know, support within the health sector, but support also at community level, support by your partner, to actually take the drugs as one needs to take them.
Yeah, very important.
Yeah.
So for the mothers, for example, who are still skeptical or still scared to breastfeed their babies, what other alternatives can they use? Can they use formula? What else?
I would not encourage formula. I think that it's more important to address the reasons for fear. A common scenario is that we have been having programs for preventing mother-child transmission of HIV for the last 20 years or so, 24 years. And during that time, the protocols have changed. And the moms who have these challenges often have, in a previous pregnancy, they were on a different protocol. And now they're on this protocol. So the health messages of the past are no longer the best approaches. They are new messages. I think that's where a crisis actually arises. Yes, we have very clear research data and program data showing that HIV-free survival, you're alive and free of HIV, is best for the mother who is on antiretroviral drugs and is breastfeeding. Remember, these babies are babies first, so all the other risks of infection or death from infections are there, just like any other child. But the HIV-exposed child is a bit more vulnerable because mom's immunosuppression as part of her HIV infection. The baby doesn't get the same level of protection from the mother in terms of antibody transfer as a bad child who's not HIV exposed. So even when you look at the numbers, the data, the child who has been exposed to HIV is actually, the survival is lower than the one who has not been exposed to HIV at all. And then among children who have been exposed to HIV, the HIV-free survival is best when mothers are breastfeeding. Yeah. And I think it's important that women feel confident that their breast milk is still the best product for their child. And we as a community, as a health community, as the village, so to say, we support that mother to be able to breastfeed effectively. And the same guidance, exclusively breastfeed for the first 6 months, and then introduce complementary feeding, continue breastfeeding until 2 years, and during that period of time, make sure that you're taking your medications as you should. As often. Now, soon after delivery, many women feel blue, It doesn't feel great. It feels like something's been removed from you. And sometimes during that period, in that state of feeling blue, you may not be as motivated to take your medication. So an awareness that this can be an issue. The other is that there's a very a large number of women who experience intimate partner violence. So if you're disorganized, you're in that state of disorganization, you may forget to take their medications. And so these are the scenarios where you find that a mother is not taking her medicine. And then, of course, if you have a feeling hopelessness, and also purpose for living, then you may not take, we know when you are feeling like that, you don't take your medicines, and you also don't give your child the medication.
That's true.
And the net result is that child actually can get infected. But given the medicines we have today, it's possible for us as a country to completely eliminate mother-child transmission of HIV. And when we talk of eliminating, it means that overall, count the numbers in Kenya, we have a sustained less than 5% transmission. When we started off many years ago, we used to have like 100,000 HIV-infected children born every year. Today, we are down to about 6,000. Yes. It's an amazing journey over a very short period of time. But we need to go to that last mile so that child is not HIV infected. And we need to build the confidence of that mother to be able to confidently breastfeed and give her baby the best.
Compared to the recent past, do you feel like there is now more awareness, or is there more that needs to be done in creating awareness and just informing the mothers in general?
There's definitely more awareness of HIV in the population compared to, say, 40 years ago. There's less fear for HIV now than in the past, because in the past we didn't have drugs.
Yeah.
And the